If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. This is our 16th season, and as you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we're here to bring you timely health discussions. Now, for those who are new to the show, there are two ways to get your questions in. First, you can call the live phone line at 718-499-6101. And second, you can email your questions to askthedoctor@netny.net, and we'll bring them into discussion. Now, for this episode, we have Dr. Julia Katz, Associate Director of Outreach Program and a cardiologist at the New York Methodist Hospital. Dr. Sandra Koifman, Psychiatry and the Director of the Electroconvulsive Therapy at NY, New York Methodist Hospital. And Dr. Emil Bakash, Medical Director of Subacute Rehab at the Center for Nursing and Rehab. Welcome. I want to thank you, the guests, for coming here on this Valentine's Day. I want to start off, so we don't forget it, by thanking the wives. And I have a special situation here, because to thank the wife, we have the, which would you guess is the husband and the wife team? Okay, is it 1, 2, or 3? Number 2, for those who said 2 is correct, and Dr. Koifman and Dr. Katz are here. And was there any discussion about coming on Valentine's Day? Or?
No, not really.
I still owe her a wonderful dinner.
And Dr. Bakash,
I have a very understanding wife.
Gina.
Gina is very understanding. That
Beautiful
she allowed
and
me to be on your show.
And,
thank you for inviting me.
Thanks for coming. I think it must be about 15 times or something
maybe
like that.
15 or more. Yeah.
But anyway, we're gonna meet the guests in a little while. I just wanted to make sure we got that in. In the news, this is a very important part of the show to keep people abreast of what's happening at this time of the year. One was an interesting one on inhaling your coffee. It's coming in for $2.69 in a lipstick-sized canister. You can start squirting the caffeine in your mouth. It comes in a lemon and lime powder, and it has this 100 milligrams of caffeine, which is about equivalent to a good strong cup of coffee, and you don't have to pay for the coffee and so on. The worry here is that kids are going to find this glamorous, and we've had problems with kids overdosing on some of these drugs, the drinks, these what are those things called?
Red Bull.
Yeah, like the Bull, what?
Red Bull.
Red Bull and
drinks,
stuff.
Yeah.
And they come in the emergency department with arrhythmias and problems that they shouldn't be having. And also some kids use it to allow them to drink more alcohol because you don't get as drowsy if you inhale the caffeine. So there are some worries. It's not restricted, it's age not restricted, so it's a little worrisome. So parents be on the lookout for this inhaled caffeine. Kids and sleep. And I say the more things change, the more they stay the same. Apparently they did studies back to 1880s, and people were always complaining that kids did not get enough sleep. And in the 80s they blamed it on the radio, then they blamed it on the telegraph, then the TV, and now they blame it on the internet. So apparently kids have never gotten enough sleep, according to, so maybe we better look at what the recommendations are, because maybe they're overestimating what you really need to have. Now, this is one you got to try and remember. The more you eat, the more you may forget. They did studies and found that people who were over 60 who ate twice as much in calories as those who ate half as much had significantly higher rates of mental inability to comprehend, to forget, and also Alzheimer. So Dr. Koifman, what do you think about that? Do you notice any association with food and Alzheimer's or cognitive memory problems?
I think the question becomes what cholesterol does to Alzheimer's patients and what cholesterol-lowering drugs can do in these situations. So it's kind of still in development. So you answered my question with another question.
That's
it.
Very good. Thank you very much. And what we'll do now is let them eat cake for breakfast. What do you think about this? People who ate cake for breakfast, the 600, nice chocolate cake I'm talking about, like a Sara Lee, they eat that, and they ended up losing more weight down the road than the people who didn't have this cake. And somehow it satisfies the cravings for food. And they followed it up to a certain point. Amazingly, 16 weeks into the study, there was a 20-pound weight gain on the group that didn't have the cake and a 15-pound weight loss on those that did have the cake. Yes. So there's good news for the Twinkie lovers out there and whatever. It may be good, but maybe ask your doctor before you indulge. I see Monsignor Bennett out there. This Monsignor has been here It hasn't missed one show. I want to just say hello. He's giving you away. Hi, Monsignor. It's good to see you. Now, we're going to have the quiz. Interestingly, it's Valentine's Day, so we're having a president quiz because we feel like we want to be ahead of the time. Last week, we actually did our Valentine's Day quiz. Question is, who was the first president to ride in an automobile and an airplane? So he drives in an automobile and he takes a plane to go abroad. Who is this president? All right, now think about that. You know, I can see the Googling, you know, people. And remember, the all-important plaque is up the stake. So the number to call is 718-499-6101, where tonight's topics are cardiology, psychiatry, geriatric medicine. Now, you can also email your questions, if you're good at that, to askthedoctor@netny.net. And don't go far, because we got a lot of interesting things, and we're going to be right back. So see you soon.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and will even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are cardiology, psychiatry, and geriatric medicine. I'd like to meet the doctors again. But before I meet them, there was a study this week, it came out yesterday actually, that showed that people who had names that were easier to pronounce got ahead in life. They tended to be the CEOs, the leaders, and make the most money. So as I'm just wondering, Katz is easy to pronounce, so,
yes,
and you've gotten far. So tell us a little bit about how you got here tonight.
To the show. I became a cardiologist about 10 years ago, and I worked as attending cardiology and invasive attending at the University of Medicine and Dentistry in New Jersey, where I taught and served as a full-time faculty, and now I'm full-time faculty teaching attending and a cardiologist at New York Methodist Hospital.
Right, and you're always, now, it's Valentine's Day, so just give us a little insight into, was this some romantic meeting, or how did it come about, this union?
Do we tell the real story?
Tell the real
The
story.
short version.
The short version.
But this is, remember, it's a G, it's a children's G.
We got set up.
Yes. Really?
Yes.
Set up.
My aunt was walking her dog, and Yulia spoke to the dog in Russian. And
It's not because I was so lonely.
No,
Just the dog
and my
spoke
aunt
Russian
said,
at the time.
I have a boy for you. And that was pretty much that. In 3.5 weeks, I proposed.
3.5 weeks. Wow. So this is, you never know what you're going to find out on Ask the Doctor. And now
You never know what you're going to find when you speak to the dog in Russian.
There you go.
So tell me a little bit about how you got into psychiatry. Why were you interested in psychiatry?
I just enjoy talking to people. I enjoy knowing the fact that simple conversation can make a difference. Doctoring and what we do, so much of it revolves around complex tests and x-rays, but ultimately it's about a conversation, about what you do when you get in the room with the patient, and focusing on that.
I have to ask you one thing, because when I'm reading the teleprompter, this electroconvulsive, I'm getting all garbled in here. Tell the audience, please, what that is so I don't confuse them. What is electroconvulsive therapy?
ECT is one of the oldest treatments we have in psychiatry, and there isn't a whole lot of talking going on when you get ECT, but it's an incredibly effective treatment. It is what works when everything else has failed.
Does it hurt?
It doesn't hurt at all. It's done under general anesthesia. It's an incredibly short treatment, incredibly effective. It's about 2 to 3 times more effective than medications. So if you have tried other things and they haven't done the trick for you for your treatment-resistant severe depression, ECT can be a very good answer.
So anybody out there with depression, and you know, you want to make sure that's right for you, you can speak to Dr. Koifman, which is easy to pronounce, Koifman, the electroconvulsive
Like Kaufman
stuff.
with an oi, as one of the salespeople said.
We're doing Fiddler on the Roof next week. But, so thank you very much for that, because I know that a lot of people, depression can be hard to treat.
Absolutely.
And this is often overlooked. And
we're the only ones in actually Brooklyn and Staten Island offering outpatient ECT treatment. So Methodist actually is in a unique position to help a great deal of people. So.
Excellent. And now that the union, any offspring to talk about?
Of course, of course.
There are two boys.
And they know they're gonna go to Harvard for medical school. They've decided amongst themselves. And by the way, there are not even 3 in total. So.
What's the name so we can give a shout out?
Joseph and Gregory.
Joseph and
they're
Gregory.
Watching right now.
And thanks for allowing your parents to come here tonight. Somebody must be babysitting?
Yes.
Parents.
Thanks for Dr. Katz's parents. So we have Dr. Katz, Dr. Koifman, and now Dr. Bakash, who's no stranger to the audience.
Hi.
And did you bring some things with you here today?
I did. I brought some props. I brought a heart, you know, which is different than the shape of the Valentine's heart.
Yeah, tell us why. Just give us a quick one on that. Why that, you know, the typical...
Oh, well, there's a few different theories of what the Valentine's heart looked like. The first one is that it was just a bad drawing that was found in the medieval times, and at that time there was very little anatomy known, and the only animals' hearts that they used to look at were cows' hearts, which resembles that heart a little bit more. That's one theory.
That's
the V
heart. They call
yeah,
it.
the V heart. Yeah.
Okay.
The other theory is, the second theory is that actually the Valentine's heart represented a drawing of a female's buttock upside down.
Next one.
And that's actually, because if you look at it upside down, it looks like a drawing,
we get
which
a
is
point,
a children's show. You don't really want to hear that. And the third one is that there's a seed in northern Africa that the Egyptians used to use this as a contraceptive, which is obviously not.
Anyway, we used to have a good show. We used to be on Monday to Friday. No.
And it was a symbol of romance in those days. And the seed, if you look at the seed, it was a siphon seed, which is no longer in existence anymore. It looks exactly like the Valentine's heart.
Thank you for enlightening us. Now, we got a whole line of things flashing. I just have a couple, as we're dealing with this President's Day coming up, right? Let's see, who's the tallest president that we had? Who's been the tallest president? He was a very honest president. He had a nickname, Honest.
Oh, Abe.
He was 6'4". Abe
Marfan syndrome.
Yeah.
Marfan syndrome. That's right.
Interesting. Yeah.
Interesting from every single perspective.
Yes.
So if you think about it, starting with the argument.
Yeah. Who was the last president not to go to college? This president was most recent, and he didn't go to college. Oh.
We don't want to be offensive.
Harry Truman, not that long ago, I think back in the 50s, or right, it was the late 40s or early 50s, never went to college. See, look at all the money. Now parents are saving money for pre-K and for kindergarten. And here this guy never went to college, and he became president of the United States. Pretty good, huh? Now, how about this one? Who's the only president not ever born in the continental United States? That means he was born in either Hawaii or Alaska. Who could that be?
Obama.
Obama. Yeah. So, just a little, just to get us into the presidential holiday coming up. And now we're going to find out. We always have like a little contest. Who's going to be the first caller? Could it be Maddie? Could it be Grace? Could it be Joel? Could it be Patrick? Let's see who it is. Hello. Who is this, please? Could be nobody. That's who wins. Who's going to be the first one tonight? Grace?
Yeah, it's me. It's Grace.
Grace, how are you?
Yeah, happy Valentine's. Where'd you take your wife? Did you take your wife out for dinner?
No, you know what I did? I was babysitting today with my wife for our daughter and son-in-law, so they could go out to dinner.
Oh, that's nice. God bless you for that.
I got a little bit of throw up on me. I'm sorry about that, Grace, but I'm covering it up carefully. What did you do for dinner?
No, we went out for breakfast because my husband can't see too well driving at night. We went to Floridian. It was very nice.
Yeah, how is that diner? I pass by there a lot. It's tricky
very
to
nice.
You know the Floridian diner?
Very nice.
Very nice. What'd you have for Valentine's Day in there?
Oh, well, we had scrambled eggs and home fries and whole wheat bread.
Delicious.
And
Very good.
You know.
Aren't many diners left. There aren't many diners left since the Kings Plaza diner closed.
I know, and the Arch. We usually go to the Arch for dinner.
Yeah. So Grace, do you think you have an answer to the quiz?
Well, I had a question, but do you have no ophthalmologist? She said they would take my question anyway. It's about my husband. I'll tell you the quiz in a minute. I got we're debating 2 presidents. So, but anyway, as far as my husband, he had, he's 79. He's going to be 80 in August. God watch him. And he had a cataract removed from his left eye, and he was fine. He saw fine. And
what's the question?
He was able to read and everything, but that was 5 years ago. Now all of a sudden, within the last year and a half, he cannot read. He has to use a spyglass. He was told to go to a retina specialist, and they told him that he had fluid in the eye, swollen and he's been taking eye drops.
All right, Grace, I see Dr. Backash shaking his head. We may have an answer today. Dr. Backash?
Well, yeah, in this age group, when the cataracts have been fixed and then they still can't see, it's usually due to a problem in the back of the eye. And if the ophthalmologist said he sees, wetness, and it's something that might be called, wet macular degeneration, which is a form of degeneration of the macula, which is a part of the eye, which is the main visual part of the eye. There's two different kinds. There's a dry and there's a wet. The wet, there's a treatment for it. Sometimes they give drops or injections in the eye.
Yes, he tried injections. I'm sorry for interrupting. He tried Avastin.
Right, Avastin it's called. Right.
But that didn't help either.
Right. If that didn't help, he may just need some visual aids, and they'll try. There's different treatments also, laser, which haven't been that effective in slowing the progression down, but he may need, magnification and things like that. They'll try to slow down the process of the degeneration of that area of the eye, but it's often not curable. In fact, it isn't curable. It can be treated, but it's not curable.
Grace, keep tuning in because I'm trying to get an ophthalmologist for next week, okay?
Yeah, I want to try and guess
the quiz.
the puzzle.
Okay. Let me repeat the question again.
Yeah, I have two answers, but...
okay. Grace, turn down that TV. I can hear that in the background. It's distracting.
Lower the thing, Tony, please.
Okay.
Yeah.
Who was the first president to drive a car and fly in a plane? Who is it, Grace?
Well, I'll take it from my husband this time. Woodrow Wilson will say.
Okay. Grace's husband says Woodrow Wilson. Is that correct, judges? Oh, Grace, I'm so sorry.
My guess was going to be Buchanan.
Oh, I can't tell you about it. I can't divulge anything, but I'm sorry.
Mine was going to be Buchanan.
I'm very sorry to hear that.
Yeah.
All right, Grace, I have to move on. I hope you call back next week. Take care. We now have Larry with us on line 3. Hi, Larry.
Hi, doctor. How are you?
Is this Larry from Rockland County?
That's correct.
I was just telling Dr. Katz, we have all over the state, the country. This is. Are you watching on computer?
But yes, I'm watching on the computer, but it's a little difficult, getting onto the program. That's why I called this afternoon, and I've been on the line since then.
Well, thank you very much for the loyalty there.
A happy Valentine's Day to everybody. Question to Dr. Katz. I'm a diabetic, Dr. Katz, and I recently went to my doctor, and he gave me amlodipine, I think it's called. He said it was because of my blood pressure, but I'm taking a medication called the Cinepril, and that's for my blood pressure. Why didn't he just increase what I have been taking?
It's common. It's common to be on several medications, and often lisinopril is a very appropriate choice for you being a diabetic. Simply increasing the dose of the medication most of the time will not reach the goal, and the goals are, to make things simple, are lower in diabetics. So the synergy, in a way, or combination of medications tend to achieve that goal faster, and it's not uncommon. In fact, it's probably the most common scenario to have several medications for blood pressure if it's not well controlled on one.
And there won't be any side effects?
Any medication you're taking will has a potential for side effects, but the benefit of controlling your blood pressure, especially when you're diabetic, usually outweigh those side effects. And I think the answer to that, you have to follow up with your doctor and raise any concerns that you have. If you started experiencing any new symptoms, then you should address it with your physician to see if they can potentially be precipitated by a new medication.
How's that pacemaker? I remember you had called us a couple of months ago. You had any problems, any pains or anything?
No. Well, I'm having a little discomfort with it. It seems to be like rubbing against the bone, the breastbone, and it causes some discomfort sometime when I assume a certain position. Yeah.
To have a little bit of discomfort is common. It's just not something you were born with. It's a foreign body. So it takes a long time to get used to. And actually, if you're skinny, you're more likely to experience a little bit more discomfort because it's going to be closer to the bone. You're simply not going to have as much muscle.
Yes, that's what the problem is.
So how is this picture coming in? You appreciate Dr. Katz's dress for Valentine's?
I tried.
Absolutely charming, absolutely charming.
Okay, so thanks for calling, all right?
Yeah, by the way, is there the answer to that quiz?
Wait, we do drama first, wait. So the question is, which president was the first to be in a plane and an automobile? And the answer is?
I think it was President Franklin D. Roosevelt.
I'll ask the judges. Judges, was it Franklin D. Roosevelt? Oh, I feel it stabbed me in the heart. I felt the pacemaker.
How's your pacemaker?
Okay.
Thanks for trying.
Thank you very much, Doctor.
Take care. Bye.
Right.
We're going to take a quick email because of, I see we got Carolyn in Virginia calling in. Her mother watches the show and gave me the information so she could write. Maybe you could direct me. And this is a woman with constant pain. I'm going to summarize. She's had MRIs that are negative and all kinds of studies that are negative, but pain when she walks down the front of her legs and down her thighs. EMG showed no pinched nerve. She's been to different chiropractors. Saw a Dr. Marcus in New York City, helped the 24/7 pain, but not her low back pain. And she doesn't know what's going on. The medications they're giving her make her feel drunk, and this pain is persistent and nothing can be found. What do you think, Dr. Bakash?
It sounds like you have a condition called Miraglia paresthetica. I know that sounds very foreign, but there's a nerve that is the nerve that brings sensation to the lateral and anterior part of the thigh. It's called the lateral femoral cutaneous nerve. And in patients who are overweight, because of the abdomen and the underwear that kind of digs into the skin, it puts pressure on this nerve and it causes numbness in that area. The treatment is to wear loose undergarments and to lose weight. And there is no test that will show this to prove the diagnosis. It's made on clinical grounds in a doctor's office.
How do you just spell that?
M-E-R-A-L-G-I-A and paresthetica, P-A-R-E-S-T-H-E-S-I-C-A.
I think we'll put that on the website so that she can see it.
Miraglia
okay,
paresthetica.
We'll put that on the website. Okay, we now have Betty who's waiting patiently with us. Hi, Betty. Hi, Betty.
Hi.
How are you doing tonight?
Oh, just wonderful.
Which neighborhood are you calling us from?
Mill Basin in Brooklyn.
So where do you like to eat in Mill Basin?
Oh, Mill Basin Deli, of course.
Oh, that's the artwork on the wall, right? You know that.
Not only that, they added a whole big room in the back.
How do you pronounce that? Erte?
How do I pronounce what?
The artist.
Erte.
Erte. It's a multi-million-dollar collection.
Come in there when he was in New
You must go in there.
Oh,
the deli's not so good, but
no. The paintings are beautiful.
Yeah, so you like that place?
We've been going there since they opened 40 years ago. That's when we moved in here.
So who do we ask for when we go in there?
Anybody. They're all good.
All right.
The waitresses, I know a lot of them, but, you know, and they're all good there.
Very good.
We were at an 80th birthday party there recently.
Very nice. We'll have to check it out.
Yeah,
so tell us a little bit about what's ailing you.
Huh?
What's the question?
No, I wanted to try to get the answer.
Oh, okay. Well, who was the first president to be in a car and then to be in a plane?
Could it be Theodore Roosevelt?
I got to ask the judges. Judges, is it Theodore Roosevelt? Whoa! And Dr. Bakash thought it was Theodore Roosevelt. I wasn't sure. What was there one thing that hit you right away, or took a little research?
I have a smart son.
Very good. What's his name?
Michael.
Mike, we're going to give Michael a shout out.
Yeah.
And where's your plaque going to go?
Oh, someplace. I have so many pictures. I'll move something.
Handmade plaque in
I
Japan.
watch the program
Top-notch thing.
For the last 16 years, I watch it every week.
Thank you so much, and we're going to get that thing. We send it, you know, due to the budget, we send it freight. You should be getting it in a week or so.
Goody. Well, we get a lot of mail around here.
But anyway,
there's trucks all day.
Happy Valentine's Day.
Yeah, you too to everybody.
Good to hear from you. Take care, Betty.
Thank you.
Okay, that was a nice story. Yeah, the deli is not a bad deli actually. And Hi, James.
Hi, how are you doing?
Good. Where are you calling us from?
Middle Village.
Middle Village. Refresh my memory. What's out there to eat?
You know, Lenny's.
Oh, yes. Lenny's.
Woodhaven House.
Lenny's, London Lenny's.
Right.
Love that place on Woodhaven Boulevard. Anybody been there?
Yeah.
For fish, plain, right? It's not a lot of money that they charge, and it's plain, but it's still fresh and delicious.
Yes.
And so London, did they take reservations?
No, you can go in there. You know, you don't have to.
Is this Lenny?
Just walk in.
No, I don't know who the. But
it's
anyway,
hard to find parking though around there.
I know, on Woodhaven Boulevard, and you cross the street, you get killed trying to cross there, right? Warp sense of humor. I don't know. I gotta make her laugh. I say someone killed, she laughs. So tell me, what? Any other tragedies? No. Okay. So.
Yeah, I knew the answer, but I wanted to ask a question about cardiology.
Oh, sure. What's the
Well,
question?
since I have, the breast surgery, it turns out I have fibrosis lymphedema on the left, on the left breast. And will that interfere, like, with my heart?
Right, so she's got pain in the breast from the surgery.
No, I have lymphedema.
Edema. It's lymphedema?
Yes.
Yes. So I'm gonna.
I'm not really sure.
She had lymphedema. It's hurting her, the breast.
But you want to make sure that this is not. You want to make sure that this is not the heart.
No, I want to make sure it's not going to interfere with anything with my heart, the swelling.
No, the swelling by itself should not interfere with anything in your heart. It's way outside where the heart could be affected. So,
will it ever go away, or the swelling, or?
When it's Dr. Bacchus, you think that lymphedema?
We do that at Methodist Hospital. They actually have compression devices which actually can decrease the lymphedema, and if you have treatments every once in a while, it'll decrease the swelling and increase your comfort zone.
I have the machine for the arm, but this
great.
is on the breast.
Oh, on the breast itself. Okay.
Yes.
Have you had the surgery recently?
A year ago, almost a year ago.
Yeah, sometimes what happens, well, you should obviously be checked by your doctor who did the surgery.
I went to the doctor.
Yeah, sometimes
if
you wear
and I went to the surgeon.
Sometimes if you wear a loose bra, that can happen, and you can get like this orange peel appearance from the breast hanging. So if you wore a tighter bra and bring your breast closer to your breast, you might get less edema in the breast. Because sometimes as you get older, women tend to hang, and that can cause water pooling in the lower parts of the breast, and that can make it swell. So you got to wear a bra that brings your breasts up closer to your chest. Sure. A lot of women, older women, don't wear bras, but you should really, make sure. I don't know if that's the situation.
No, I always wear a tight bra. In fact, this breast is like a torpedo. The other one went down south.
We do have that lymphedema clinic I told you about. There's a clinic actually at the Methodist Hospital.
Yes.
Did you ever try that out?
Well, the radiologist said if I had it dressed, that it would only come back.
I would go to that lymphedema clinic. I've seen them do wonders. Give
Really?
a call. I'll give, the number we'll put up on the screen. You can call my office number, and we'll give you a referral tomorrow, okay?
Okay, thank you.
Okay, take care. We've got to take a break, and I don't want Dr. Koifman getting depressed, so I'm going to give him a cliffhanger question. Those of you out there, you're feeling a little bit depressed now, maybe it's Valentine's Day, it didn't work out the way you wanted, but it might be something else. And I'm going to ask Dr. Koifman, is there a relationship between depression and maybe a heart attack down the road? So think about that while we take this break. Tonight's number is 718-499-6101, where our topics are cardiology, psychiatry, and geriatric medicine. We'll be right back to talk about depression.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available, and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
Welcome back to Ask the Doctor, where our topics are cardiology, psychiatry, and geriatric medicine, where we have Dr. Yulia Katz, Dr. Sandra Koifman, and Dr. Emil Bacchus. Let's get back to the questions, but first I promised you we don't want to bring up depression on a night as happy as tonight, but people do get depressed, and maybe on Valentine's Day, can you give us some tips why they shouldn't be depressed, and then talk about that connection between depression and heart disease, please.
Sure. Maybe we can talk about the depression and heart disease first. There's certainly some association between depression and heart disease, and there's more and more being researched and looked into. There's an association that if you were to have a heart attack and you do develop depression, you may not recover as quickly and as well. Also, you are at higher risk of having a depressive episode. So if that's the situation, if you had a heart attack and you're starting to feel the blues, you may want to address it sooner rather than later and bring it up to your cardiologist. Many cardiologists are very well aware of the downside of the emotional impact that a heart attack may have, and will work with you and refer you to a psychiatrist if need be. And the opposite may also be true. The data is not as strong, but there's certainly some association there that if you are depressed, you may be at higher risk for some medical problems.
Really? So by treating the depression, do you improve your risk of
That's an open question, and it may or may not be the case. But certainly, if you already had a heart attack, that's something to pay attention to, and pay attention to how you feel emotionally.
Now, let me ask you another. If I'm sitting out there and I don't know, how do I know if I'm just feeling blue because I didn't have a day tonight, or I'm really depressed? What are the signs that I'm really depressed?
There is a great deal of mix-up that happens in just colloquial language. You turn on morning TV show and people will talk about how they're feeling depressed because their bus was late or coffee is not strong enough. What we talk about as far as depression is concerned, as far as an illness defined as depressive episode, depressive illness, is quite different from just feeling sad and having the blues because you didn't get a date or you're having a stressful day. Depression is when it starts to feel like there is a weight on you that is well beyond of just being upset about something concrete, where you feel like an outside force is pushing you down. And it's quite different from having a heart attack. It's not an immediate thing. But when it starts to follow you and continue for weeks at end, when you're talking about more than 2 weeks of not being able to shake it, feeling down, feeling low energy, poor appetite, inability to laugh, enjoy things that you normally enjoy, losing weight or gaining weight for some people, having sleeping problems. You have to have all of those things together to start thinking about, is this a depressive illness? And of course, if you start thinking about more dire things and more severe symptoms like thinking that life may not be worth living, you absolutely have to take it very seriously. Come see a doctor as soon as possible. Go to the nearest emergency room if you must. But this is a serious illness and it must be treated. And it is treated very well. It's one of those things that we actually do a pretty good job in getting people through quickly.
That's good news. Anybody contemplating committing suicide is not a joke. You get right into any emergency room.
And you have to know that New York City provides a free phone line, 1-800-LIFE-NET. 1-800-LIFE-NET. You can call 24/7. There are crisis intervention counselors on the line. There are social workers that will help you if you need help right away. So 1-800-LIFE-NET, it's a number I frequently give to my patients.
We actually gave that out. We had someone call in a few last season, actually, Gregory, I think, and we turned them over to that LifeNet.
Very important.
Yeah. And then I just want to say to Joe Stiles, who one of our most loyal listeners, having trouble getting through. Joe, I know we're having trouble with the phones. Don't worry about it. We know you try to get through. So it's always great, and I hope you're feeling well. Give me a call tomorrow, okay, Joe? Take care. Let's go to Shemaini. Shemaini.
Hello?
Am I calling that? Is that the right way? How do you pronounce that?
Hello?
Yes, hi. How are you?
Yeah. I'm fine, thank you. I just have 2 questions.
Can you tell me, though, how you pronounce your first name?
Shamin.
Shamin. Ah, Shamin. Beautiful name. You have a nice soft voice, too. It's a very mellow, right? It kind of lulls you into security and you want to sleep. Yeah.
What could be psychiatrist.
Yeah. So what's the question?
Yeah, the question, I have 2 questions to ask the doctor. Recently, I find like when I'm sitting down and it is like I have this sharp pain like a needle under my left breast.
Okay.
And sometimes it just comes on sudden and I cannot move, and like for a split second I will be getting numb like if I want to pass out. And it's like I will have to take my right hand with my make a fist and just put it under my breast just to stop the pain. But the pain is a sharp pain like a needle just coming.
How old are you, Shamin? How old are you?
I just turned 43.
43. You have any medical problems, diabetes, anything?
Never have no medical problems.
Okay, I'm going to ask, we have 2 opinions I'm going to get here. First, Dr. Katz and then Dr. Bakish. Dr. Katz, what do you think's going on here?
You need a little bit more information. Simply speaking, pain that can present in women that can present as true heart pain. Women have sometimes different symptoms. Women and men has a little, it's been gaining recognition that women and men have different presentations for heart disease in general, and probably different mechanisms that are responsible for that. Simply speaking, just from the couple of things that you told us today, it doesn't sound like it's something terrible is about to happen. Your pain is what we call rather atypical, and it does require attention, not because of the part that it's pain on the left side, but because you feel that you're ready to pass out. Out of the 2 things that you said, this is a more concerning part of it to me. but you really need to spend a lot more time with the doctor trying to tease out what exactly happens and how it happens and what brings it on and what makes it go away to be a little bit more precise.
Thank you. On the other hand?
Well, at 43, menstruating females generally don't get heart attacks. Sharp pain is not usually cardiac pain or heart pain. The pain you're describing sounds like you're having an intercostal muscle spasm, what runners call a stitch. And it can be very severe because it hurts a lot. It can take your breath away, just like you described. So it doesn't sound serious, but I certainly agree with Dr. Katz. You should be examined and you should be checked out. But menstruating females don't generally get heart attacks unless they're heavy smokers or diabetics or have some other underlying disease.
Thanks so much.
I'm sorry to interrupt you. I don't smoke. I don't drink. If I drink, it's just social at my house. I will have a glass of red wine with my dinner, and that's it. But nothing else. I never have a medical problem.
Beautiful. So it sounds like you're. It
Should
sounds
be
like
reassuring.
Sound like they're reassuring you, the doctors, that it doesn't sound very serious, and you know, just let's.
The last question I want to ask.
I got to move fast. What's the question?
The last question I want to ask you. It's for the past 2 weeks, in the middle of my sleep, I'm having a terrible pain in my right arm, and this pain is a pain that's like deep from my arm right into my chest, around my right breast, up my neck. And it's a pain, it feels like if my hands are tearing away from my chest. And it wakes me up out of my sleep week before, and it happened again last week.
All right, Shamin, I want you to watch the TV. We're going to give you the answer because we have to move on, but watch it on the TV now. Dr. Bacchus?
Yeah, most likely you're having a positional situation with positioning in bed in your neck, and the kind of pain sounds like you have a radiculopathy that's radiating from probably your lower cervical spine, you know, C6, C7, that radiates down to, yeah, this is a lumbar spine, but the neck is kind of similar.
Hold it straight so they could zoom in on that.
There are nerves that come out of the spine, and I'll just turn it.
Those yellow things.
These yellow things, and if your neck kinks, if this bends and it kinks on this, wherever this nerve goes, you'll have pain. So it's probably that kind of a situation that if you're sleeping and it's positional, it can press on the nerve, and then you wake up with this sensation that's very foreign to you and very uncomfortable, but then it eventually settles out and you're okay. So you could get checked out with the doctor, but generally that doesn't sound as serious as it may feel to you.
Thank you very much. Thanks, Ann. That was Shamin. Thanks again, Shamin. We'll give us a call back and let us know how you're feeling next week, okay? Let's go to Ann now. Hi, Ann.
Hi.
Where are you calling us from?
Bayside.
Bayside. A lot of places out there, right?
Yes, many.
What's your favorite out in Bayside?
I like Donovan's.
Donovan's.
Yeah, Donovan's good.
Isn't there also a Ben's Deli? We had a deli in Brooklyn that Betty gave us. I think there's one in that shopping center there.
Oh, I don't know.
Yeah, pretty good food.
Not
so
sure.
What can we do for you?
Well, I've been suffering with, I feel like my bones throughout my body hurt. And I feel like now it's going into my neck, like on both sides of my throat. My joints hurt me, and the back of my feet. I feel like maybe it's coming from the back of my feet and throughout my body.
I want to just interrupt for a second, Ann. Dr. Koifman, talk about the relationship of some of these diffuse muscle pains and joint pains
throughout my body.
And depression. Tell us a little bit about that, or antidepressant treatment of that condition.
Right. There are more treatments now for one of the things that comes to mind, fibromyalgia, of course. It is a treatment, it's an illness that is very difficult to, an entity that is difficult to define. There are specific criteria, but they're somewhat made up criteria. You really have to exclude everything else before you can get to someone and say with some degree of certainty that you have fibromyalgia, for example. The other thing to keep in mind is that if you are feeling depressed, sensation of pain is quite different, and we all know how painful a paper cut can be when you're sitting in the office and working versus when you are horsing around in the woods and you get a whole giant gash on your hand and you notice nothing. So mental states make a difference. When you talk about diffuse pain, I'm almost certain at some point someone will suggest going and seeing a psychiatrist. It is a very common scenario. where pain management doctors work with psychiatrists in concert. And it's very important to take that suggestion as a reasonable step in investigation of whatever is going on.
And thanks a lot. I got to move on, but I think it's a good tip. Just, see if you have any signs of depression, and maybe a visit to the psychiatrist would be in order.
And pain management.
And/or pain management. Thank you. Before we get to Rosemary, one of our most loyal calls, I just got another email. I'm trying to get these in. It says, good day, I'm taking 4 high blood pressure medications and high cholesterol pills a day. Plus, I'm taking vitamin D, vitamin B6, pomegranate juice. Is it okay to take them all at once? Thanks a lot. So he's taking multiple medications. What about taking them all at once?
Usually it's okay. Usually it shouldn't be a problem. Most of the medications can be taken with food and at the same time. The reason to space them out would be not too much medication at the same time, but rather if, let's say, 4 blood pressure medications tend to lower blood pressure at once, and then from high you get low, and high doesn't make you feel well, and low makes you feel unwell as well. So that's when we tend to ask people to not really monitor their blood pressure once a day, but write down times of the day when it's bad and what happens when they take 4 medications at the same time.
There's one woman out there, I always get complaints when I talk about vitamins, so I'm going to ask Dr. Katz, on a scale of 1 to 10, what do you think the value? 1 being the least, 10 being the most. What's the value? 1.
I'm not a supporter of
extra. Not a big supporter, and you're not in bed with the pharmaceutical companies.
Not for the vitamins.
Okay, so the woman in Maspeth.
No, there are certain circumstances where certain vitamins are going to be very beneficial for you, but overall for healthy population, they've never been proven to be good, and many people have been proven to be bad.
Thanks.
And that's unfortunately not known well enough.
Okay, let's go to Rosemary. Hi, Rosemary.
Oh, hi. Happy Valentine's Day, everybody.
Happy Valentine's Day. What did you do special for Valentine's Day, Rosemary?
What did I do? I ate a lot of chocolate.
Oh,
that's not that special, but that's what I did, and I kind of feel sick.
Oh, yeah. So
I overdid it. And she looks so lovely in her red dress.
I like that, yeah.
She's so nice.
Yeah, did you guess who the husband was?
Yeah, because I know.
We had to do paternity. No.
It's the Russian
I know the other actor's wife's name is Gina. I watch this show all the time. I know everybody's business.
Gina gets a shout out.
Gina's great.
So, well, Rosemary, anyway, what can we do for you?
All right. I have a question. Well, you took one of my questions, so I have to get another one. About depression, is it hereditary? I know they do studies about alcoholism, and I know bipolar. Would you be more susceptible to it if someone in your family,
Interesting.
You could be. That's certainly a very strong possibility, and that's being looked at very carefully. But yes, there is a strong association that these entities can run in families. The trick is this. Psychiatry is still quite behind in the level of precision and knowledge that other specialties, like, for example, cardiology has. Right. We don't have an X-ray. We don't have an MRI that can tell us if someone is depressed or not. So we may be talking about things that look like the same disease but may not be. So there are certain types of depression that may run in families. And if you have family history of depression that was so severe that needed treatment, needed hospitalization, the sooner you establish good, tight follow-up with someone who can help you at times of crisis, the better off you are.
Okay,
I hope that helps, Rosemary.
Thank you. Okay, bye.
Enjoy.
Okay.
We're gonna have to take a short break right now, but before we take that break, one more email because they're coming in so quickly. I got to make sure. Hello, Dr. I. Oh, no, Doctor, I have hello, doctor. I have a skin condition called rosacea. I visited Dr. Epstein. He's getting a lot of business, Epstein, here this week. I visited Dr. Epstein in Bay Ridge, who suggested I should search a clinic that would accept my insurance and get dermabrasion. Anyway, Dr. Bakich, tell us about rosacea, please. What is that?
Sure. Rosacea is a very common disease of the skin on the face. Some famous people who've had rosacea are Bill Clinton, President Bill Clinton, if you notice his red nose and his red cheeks. And also W.C. Fields had it, and he had a rhinophyma, which is an exaggerated form of rosacea. And Gene Hackman, and this kind of appearance of the skin.
She mentions rhinophyma as well.
Rhinophyma,
so, yes,
right, yeah. It's a hypertrophy of the sebaceous glands of the nose. And there's several treatments for rosacea. There are topical agents, and there's also oral agents. They mainly surround the use of antibiotics topically, like Metrogel is a common treatment, but there's other treatments as well as oral antibiotics, and more advanced treatments with light treatments that almost any dermatologist could treat. So I don't know if it's necessary to go to a particular rosacea clinic, but I think any general dermatologist should be able to handle it.
Frank, we hope that helped you. And what we're going to do now, we're going to take a short break, and when we come back, we're going to go right to your questions. The topics are cardiology, psychiatry, and geriatric medicine. We're going to do rapid fire, so we're going to get all these questions answered. Don't go far. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available and will even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back to Ask the Doctor, where our topics are cardiology, psychiatry, and geriatrics. I was just saying, we're enjoying this show. It's very good questions, and now we're going to hit the rapid fire segment. So, Dr. Katz, you're on deck. You're up. Okay, she's stepping to the plate for the question from Stephanie. Hi, Stephanie.
Yes, hi.
Hi, where are you calling us from?
I'm calling you from Brighton Beach.
Brighton Beach, one of my favorite areas in the city. Yeah, I love going there on a summer's night.
Especially in the summertime, yes.
But anyway, I digress. We were in rapid fire. I'm sorry. What's the question for Dr. Katz?
Okay, it's an orthopedic question. Maybe Dr. Backash can
answer. Right. She may defer to a friend.
Safe. All right. I'd like to know what avascular necrosis is of the hip and how can it be treated?
Okay. Avascular necrosis of the hip is when the head of the femur, which is where the hip bone articulates into the pelvis, there's no more blood supply, so the whole head degenerates. The only proper treatment is to replace the hip. You need a bipolar hip replacement.
A bipolar hip?
Yeah, it's a hip replacement, and then they give you a new hip. You're as good as new.
Stephanie,
the cause is sometimes use of steroids, so if you're using steroids, you shouldn't use them.
Yes. Can you give me a referral if I call you?
Sure. We can refer an orthopedic surgeon. Sure.
Give Dr. Backus your call tomorrow and he'll give you a referral.
Okay, thank you very much.
You're welcome.
Let's go now to Lisa in our rapid fire segment. Hi, Lisa.
Yes, hi. How are you?
You ready to rapid fire?
Hi.
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 So we just, if you could just lower that in the background, it'll help us out. Okay?
Okay.
What's your question for Dr. Koifman?
Actually, I had 3 questions.
But we need one.
Probably for each of you guys.
Give us your favorite question
Give me
first.
one.
You got to turn that TV off, otherwise we can't continue.
My mom is 70 years old.
Wait, Lisa, just turn your TV off.
Sorry
turn it
about
off.
That.
She's trying to prolong her second, like a minute. She needs extra time.
Okay,
now
is
it's
this
much better.
Okay. My mom is 70 years old, and she's a diabetic. She also has high blood pressure. Lately, she's been feeling a pain, kind of like a sharp and stabbing pain under her left breast. And we were just wondering what that could be.
70-year-old woman, she needs to be examined first by her doctor, EKG. If EKG is negative, she needs to have a stress test done. Heart disease needs to be ruled out immediately just to make sure, although the sharpness is not likely to be cardiac, but you never know. She may just not be expressing it in a correct way. So I think stress test, and if that's negative, it's not heart disease. It could be esophageal spasm.
Similar to other questions we've had. Thanks a lot for the question. Appreciate that. Let's go to Sharon. If you have another one, call back. If you get in, we'll take it. Sharon?
Who is this?
Hi, this is Dr. Garner. How are you?
Hi, doctor. How are you?
Where are you calling us from?
I'm calling from Brooklyn, New York.
You have a beautiful accent. You know, I don't detect the Brooklyn. It's like more of a London speech. Very nice.
Oh, I'm educated.
Yeah, it sounds. So what can we do for you?
Okay, my question is this. It's for the psychiatrist, okay?
Yes, he's right here.
You know, as I explained to my own psychiatrist, who I see once every month, that I need oprazolam to take away my extreme anxiety disorders, which I've had for a very, very long time. However, they're always talking about addiction this, addiction that, addiction this. Everyone's addicted to everything, and everybody's physiological makeup is different. Question is, why won't my doctors prescribe oprazolam for me when it is the drug that works and acts opposite to the most people in the country? Actually, it boosts me, it gets me up, it moves me, and it takes away my problem. And and I'm not addicted to it, and I do not abuse it.
Okay, we're gonna answer that question, Dr. Koifman, and then we'll see if anyone else wants to pitch.
How old are you?
I'm 53 years old, a beautiful 53-year-old woman who keeps herself in shape.
Alprazolam.
I mean, everybody's addicted to something like sex. I mean, putting wax on their teeth, or.
All right, I want you to turn back on the TV and listen to the answer on the TV. What do we got?
Alprazolam is one of the difficult medications for psychiatrists to manage because it's frequently prescribed by other physicians. By the time a patient shows up in the psychiatrist's office, the addiction to alprazolam is well set in. The problem with alprazolam is that, and it belongs to a group of medications called benzodiazepines. These medications are very addictive, and in a way they create their own market. Alprazolam is very short-acting benzo, so it works wonderfully for about 4 hours, and then anxiety comes back up. The more cycles of that you go through, the more addicted you become, oftentimes requiring higher and higher doses, which is all fine and good. The problem becomes when you get older. And when patients over 65 come still on the same alprazolam, Valium dosing, they are at much higher risk for falls, they're at much higher risk for depression, they're at much higher risk for a slew of other problems. So the sooner you can get to the core of controlling your anxiety rather than using the benzo as a band-aid, the better off you are long term.
And Sharon,
so think long term instead of short term. That's the key.
I wanted to get the doctor to answer the question, so that's why we put you on to ask you to watch the TV. But if you have any other questions, call back and we'll fill you in on that, okay? We're now going to go to Abida. Hi, Abida. Abida?
Hello?
Hi.
Hi, good night. My name is Abiola.
Abiola, I'm sorry. Beautiful name. What's the derivation? What origin? What country?
I'm Guyanese.
Guyanese. Beautiful name. I'm going to try and get your question in quickly. I'm going to rush a little bit. What's the
yes,
question?
Just a quick question. I want to know if stress can make you, because my left feet, sometimes it just fall asleep on me.
Okay, I'm going to start with Dr. Bakash. Everyone's going to answer this question on stress.
Okay.
I suppose stress could make your feet fall asleep. Yeah, it could probably have an effect. Usually it's related to some sort of neuropathy where there's some pressure on a nerve. But if you're in a certain position, certain nutritional deficiencies can cause it, or a certain footwear can cause it. But I guess stress could do it, yeah. Diabetes is one thing you want to make sure you don't have also, because that can cause it too.
Stress a risk factor in heart disease?
Stress is considered to be a risk factor these days. Not well recognized, but we do believe that certain things can happen when you're under a lot of stress.
Stress a good reason to see a psychiatrist?
Sometimes.
Sometimes, okay. Anyway, we hope you have a great week and de-stress. And we're going to Emily. Last caller of the night, Emily.
Hi, how are you?
How you doing? Nice to hear from you.
Good, same here.
What can we do?
I have a diabetes question. I was on regular insulin as well as long-acting insulin. Lately, my doctor switched me to a stronger strength insulin. He switched to a U500. I used to take a U100. Since I've been on the U500, I've been gaining a lot of weight. And I'm finding it very difficult to lose weight.
Yeah, the reason why you're having a hard time losing weight is because insulin causes the formation of fat, and it's lipogenic. In other words, that the food you're eating now that you weren't metabolizing is now being metabolized by the insulin, and you're making fat, and it's making you gain weight. So the key there is to not increase your insulin anymore and lose weight, exercise, watch your diet very tightly, and then you're developing something that you might be called insulin resistance. Sorry.
We got to go.
Yeah,
okay.
The studio. I'm sorry, Emily. We're going to have to take your call next week if we have more. Thanks for the answer quickly. That's it for this episode of Ask the Doctor. I'd like to thank Dr. Yulia Katz, Dr. Sandra Koifman, and Dr. Emil Bakash. It's good to remember you should always be proactive about your health. Speak to your doctors about your concerns. And remember, as you heard tonight, go for second or even third opinions. Visit our website at netny.net/askthedoctor. Here you can read the weekly tablet column and watch past episodes. I want to thank Dr. Linda Lapatosa, the Quizmaster, and thank you all for your questions. I want to apologize for rushing at the end. We tried to get as many as we could in. Also, tune in tonight for those who want to see a rerun or missed last week. It was a great episode at 10 o'clock for our encore presentation. That's 10 o'clock tonight on the same station. Next week, we're going to talk about non-invasive imaging, nephrology, kidney disease, internal medicine, and maybe even cardiology for Grace. So goodbye, stay healthy, and I'll see you on the tablet.